Good morning, one and all. Dr. Steven Zahm here with another episode of Tooth Teacher Tuesday, and tomorrow's Valentine's Day. So, happy early Valentine's Day. And again, kind of on the theme of Valentine's Day, I think a lot of us, when we think Valentine's Day, we think of heart-shaped decorations. And so I kind of want to talk along those lines. I'm going to backtrack here in a second and you'll see the connection, but today's topic is a question we get asked pretty often in dentistry, which is something along the lines of, Doc, I was told by one of my other doctors that before I have any dental work done, I need to take an antibiotic. And why is that? Why do I need an antibiotic before I have dental work done? And there can be any number of reasons, but what it typically boils down to is something related either to your heart or to some kind of artificial joint. And what I mean by that is there are certain conditions that, because of the nature of dental work, we've talked in the past, there's bacteria in our mouth, both good and bad, and when they get into our body, they can cause a whole host of problems. Among those problems would be creating issues with the heart or artificial joints. And so for anyone that's had either heart replacement or has an artificial heart valve, I guess when I say heart replacement, I mean a full-blown transplant, or if you have some kind of congenital heart defect, pretty much anything that's been done to the heart aside from, stents are not something you need antibiotics for typically. And, in the past, heart murmur used to be something we'd give antibiotics for, but we found that's not necessary. And then also if you've had any kind of bypass surgery on your heart, typically that doesn't need any antibiotic work, but more often than not, if you've had any other kind of surgery done related to your heart, it's going to make your heart more vulnerable to infection of the tissue around the heart, and that's why we prescribe antibiotics before dental work, is to just kind of proactively prevent any bacteria that may get into your body during dental work from traveling through your body to your heart and causing that infection of the heart. The same is true. Some people have had infection of the heart for unrelated reasons. And same thing again, we know at that point that that person's going to be vulnerable to having that happen again in the future. And so we give antibiotics before dental work. And the same is somewhat true for artificial joints. I'm talking if you've had a total knee replacement or total hip replacement are the most common ones that are going to come to mind. Historically, for the same reasons, we've given antibiotics before dental work because we don't want any bacteria in the mouth to get into your system and spread to those artificial joints that are going to be prone to having bacteria accumulate there, because since they're artificial, you don't have an immune system to fight those bacteria. And if those artificial joints get infected, then, it's going to not only ruin that artificial joint, but could cause further damage to the adjacent parts of the leg or whatever is next to that artificial joint. But that's been a controversial topic, especially here of late, because we're finding that may not be necessary. There's a lot of recent research that's showing that the risk of getting bacteria in your system and it causing an infection of an artificial joint due to dental work is, no different than the risk you have of bacteria getting into your system from just your regular daily activities like brushing your teeth or chewing your food. And, it's not in your best interest to take antibiotics willy-nilly. And so because we're finding that daily activity is just as likely to cause infection of artificial joints as doing any kind of dental work. And rest assured that likelihood is very, very, very low. The American Academy of Orthopedic Surgeons has kind of changed their guidelines and their recommendations for dentists that at this point in time, the recommendation is that antibiotics aren't needed before dental work if you've had an artificial joint replacement. Most of the time, the orthopedic surgeons are going to want you to wait about 2 months after the surgery to have any dental work done, but after that point in time, you're cleared to have dental work done without any concern of that joint becoming infected, you know, with a higher likelihood because you're having dental work done. If it's going to become infected, it's going to happen regardless of if you have dental work done or not. Again, this is highly controversial, especially since a lot of orthopedic surgeons were trained, contrary to that, and are a little hesitant to change their protocols. And so if you've had an artificial joint replacement, your surgeon may still want you to take antibiotics before dental work, just to kind of cover our bases. And so that's where we as dentists, we follow the guidelines of the orthopedic surgeon who performed the surgery, just based on what they recommend, because we're all different too. Some of us, even though our current guidelines say that antibiotics aren't necessary, that's a general rule. Some of us may have an impaired immune system that there is a higher likelihood of something happening after dental work, and so just to be safe, we do still recommend antibiotics afterwards. So if it's heart related, it's pretty much a guaranteed thing that you're going to need antibiotics for life. If it's joint replacement, maybe not necessarily. And so that's where it's always best to consult with your surgeon and with your dentist to see what is going to be best for your health. And so that is a very broad but quick overview of why you might be told you need antibiotics before having any dental work done, even just a basic cleaning. So hope that maybe helps clear up some confusion as to why that's sometimes an occurrence. And if you have any questions or comments to add, feel free to shoot me a message. Otherwise, thank you for tuning in to this week's Tooth Teacher Tuesday, and have a happy Valentine's Day.